Now, here with us on the phone to share the latest information on the situation is the mayor of New Rochelle, Noam Bramson. Mayor Bramson, thank you so much for joining us.
Good morning.
Good morning. Now, we know the patient is being treated in the city. Any word on how he's doing at this moment?
I don't have any updates on the patient's condition, but I will say that the thoughts and prayers of our entire community are with one of our neighbors and his family as he goes through this health crisis, and we are all wishing him good health.
Absolutely. How about his family? We know his family is in quarantine at their home. Do you know how they're doing?
I've not spoken directly to them. I think we're all mindful of respecting their privacy. But again, I think one of the things that's been demonstrated through this very difficult 24 hours, and we know that there are going to be challenges ahead, is that our community has demonstrated great maturity and calm and resiliency. That's particularly true of the members of the faith community of Young Israel of New Rochelle, who are bearing the heaviest burden. And I'm just enormously impressed by how people have come together in a spirit of mutual support.
Right. How is the self-quarantine being monitored, especially with the folks from the synagogue?
Well, that's under the supervision of the County Department of Health. We expect that most, if not all, of those who are subject to the self-quarantine will abide by its terms. We all recognize that public health is at stake and that it's in everybody's interest to follow the guidance of public health professionals. The city and myself, we are in regular communication with county and state officials to make sure that our efforts are coordinated to the maximum degree possible. I've also been speaking regularly with the leadership of Young Israel of New Rochelle, and I'm enormously grateful for the calm and constructive manner in which they have served as advocates and have engaged in communication with their membership.
I know with other instances, quarantine situations, folks are using like video conferencing with cell phones or laptops. Do you know if health professionals are using that for those who have to self-quarantine?
I don't know, although this is a fast-moving situation that changes hour to hour. And I expect that as those hours proceed, the methods of communication will expand and become more and more robust. We recognize that there are hundreds of families in our community who, at a minimum, have had their lives enormously disrupted, and therefore they are entitled to an enhanced level of support and communication and guidance as we make our way through this together.
That's right. How do you allay the concerns that your residents have?
Well, I try to remind people that this is an instance in which we absolutely should have a measure of focus and concern that is proportionate to the scale of the challenge. But we don't want to stray into unjustified panic, which is simply self-defeating. We should remember that the great majority of people who contract coronavirus will not experience any illness at all. Of those who do become sick, only a relatively small fraction will face life-threatening circumstances. So this does need to be kept in proportion. And again, I am impressed that the great majority of people appear to have struck that balance very well. I think that's a credit to our community and to the quality of the public health professionals who have been providing us with sound guidance from beginning to end.
And just really quickly, one last question. Any likelihood that you think about other exposures in New Rochelle?
Well, look, I think logic tells us that it's highly likely that there will be other instances of coronavirus. Simply the number of people who have had potential exposure leads us to that conclusion. And it is possible that additional directives will follow as a consequence. We will take the lead of the state and county officials who are at the forefront of investigating the chain of exposure, and we will act accordingly. All of us are prepared to do what we need to do in order to safeguard public health to the maximum degree.
All right. Thank you so much, Mayor Noam Bramson, Mayor of New Rochelle, with us there. Thank you so much for providing us that update.
Thank you.
And again, if you have questions about the coronavirus or think you have symptoms, hotlines have been established. You can find those numbers along with other updates about the outbreak on CBSNewYork.com.